This is KGW News at 5.
Our top story tonight, Oregon begins to vaccinate healthcare workers. You're looking at the first round of vaccinations today at Portland's VA hospital. At hospitals all over the state, from the Portland metro area to eastern Oregon, those frontline heroes got their first shots, a sign of hope on the horizon.
The more people take it, the quicker we can get back to business as usual, because then the virus won't spread.
Thank you for joining us for KGW News at 5 o'clock. Some of the first doses were given out in Vancouver and eastern Oregon this morning. KGW's Pat Doris reports.
At Vancouver's Peace Health Medical Center, first in line for the Pfizer vaccine around 9 this morning, nurse Schaefer Seabrook, who cares for COVID patients.
I think it's, finally an answer to things, It doesn't seem like what we've been doing so far has been working as numbers are getting worse. So I think this is a relief as to a step in the right direction.
The medical director said it is a pivotal time in Southwest Washington's fight against COVID.
This is probably the most exciting day that we've experienced or will experience over the long winter of discontent of the pandemic here.
To the east, Dina Ellinger, who is both a nurse and the president of St. Alphonsus Medical Center in Ontario near the Idaho border, got her shot during a live Zoom press conference with Governor Kate Brown. She said vaccinations at her hospital started at 9 this morning and that 20 people were in the first group.
These vaccinations are particularly important for this community as our spread has been very high.
Governor Brown was thrilled that people on the front lines were finally getting the vaccine.
This is truly the moment we have all been waiting for.
The Oregon Health Authority's director emphasized the vaccine is safe.
I want every Oregonian to know COVID-19 vaccination is the safest, most effective, most reliable way to keep yourself and your family and your community healthy and safe.
At Legacy Health, several frontline workers got their first shot at the same time, including ER nurse Jamie Carlson and respiratory therapist Jeremy Howard.
The more people take it, the quicker we can get back to business as usual.
I was nervous a little bit that it was going to hurt, but I didn't even feel it, so my arm feels great.
At Oregon Health and Sciences University, the first person to get the shot was a cardiovascular intensive care nurse.
If indeed it's available to all Oregonians, the challenge becomes who are going to be taking it, because there are a lot of misconceptions out there, even among my own colleagues, who are saying I'm not going to take it. So as healthcare workers, we have to be the role model for the public.
Those shots today were the first historic moments, and those folks are going to have to get follow-up shots in 3 weeks to be as protected as possible. But in the days, weeks, and months ahead, there's going to be a lot more moments like that as we all in Southwest Washington and Oregon start to sort of armor up and get the vaccine against the coronavirus. I'm Pat Doris reporting.
It really is remarkable, isn't it? And senior living communities are next in line after healthcare workers. Galen Etlin has an update on some of the first vaccinations and which facilities will get priority.
Phil Fogg has the same line a lot of us do.
Yeah, the last year has been challenging.
He's president of Marquee Companies in Oregon, which runs health services like senior living and Consanis Pharmacy. Consanis is one of only 7 non-retail pharmacies in the nation approved by the CDC to provide the COVID vaccine. It'll be among the first in Oregon and Washington to distribute it to senior care facilities.
And that will start next Monday.
Long-term care patients will get it first, followed by assisted living, then retirement communities.
It's built around who's the most at risk, who's the most fragile or compromised.
While we're waiting to get the word,
Kevin Stottleman helps run the Summerfield Estates Retirement Community in Tigard. People living there are on the early list to get the vaccine from CVS.
They're very excited and they're waiting. They've been asking every day now.
The timeline is up in the air, but he hopes vaccinations will start at Summerfield around January 10th.
It's going to be a party.
But it will take several months to get senior communities vaccinated.
Probably the most challenging thing for our resident population is not being able to see their families.
I understand that once you get a vaccine, that doesn't necessarily change a lot of the precautions that you're taking. What might that look like?
We won't just open the doors.
That still means masks, distancing, and mandatory quarantine for those who leave to visit friends and family outside. So far, Summerfield has had 0 COVID cases, but a challenge with the vaccine.
For those who are not willing to get one, what will that conversation look like as well?
You know, they're very nervous, but you know what? It's something we got to do. Okay, we survived because everybody played the same roles. We all make the right decision together to make sure everybody stays safe.
This vaccine is providing hope.
And as Phil's company gets ready to vaccinate the first seniors in Oregon and Washington, his message to everyone else is about patience and maintaining precautions through spring and possibly summer.
We're going to move from an environment where we're allocating scarce resources to where we're going to get plenty of vaccine to be able to give to the entire community.
I'm Galen Etlin for KGW News.
Today, Washington Governor Jay Inslee announced new guidance for schools in Washington. He says it's time to get more kids back in the classroom safely. Christine Pitawanich has that story.
Today, Washington State Governor Jay Inslee announced a phased-in approach to in-person learning. He says it's based on new data the state didn't have 6 months ago or even 3 months ago.
From national experts at MIT, Brown University, and Harvard, and from experts here in Washington.
Inslee showed this graph. On the far right is the risk of infection for remote learners. The risk level is similar to students attending in person with safety protocols.
We're confident that these risks are reasonable, again, as long as we adhere to health and safety measures, like wearing masks, maintaining 6 feet of physical distance, increasing cleaning and improved ventilation.
And he says COVID-19 outbreaks have been relatively small, even in counties with higher COVID activity. Half of the outbreaks this fall consisted of 3 or fewer cases. Based on all that information, the governor approved new health metric recommendations.
Once the required safety measures are in place, when COVID cases represent less than 50 residents per 100,000 in the district, in-person learning should be available to all students.
If there are greater than 50 cases, but less than 350, districts are encouraged to phase in-person learning, starting with middle school students. If COVID cases are above that 350 threshold, Inslee says districts can bring in elementary students and those with high needs in small groups of no more than 15.
These parts of our plan are recommendations as to when to return more students. They are not requirements. As governor, I have the authority to close schools, or actually the Department of Health, for emergencies. I do not have the statutory authority to make them reopen.
Camas Schools Superintendent Jeff Snell also attended the press conference with the governor.
Over the course of the last 3 months, we've been able to increase incrementally the number of students that are getting in-person experiences.
He says having small groups of students come for in-person learning was daunting at first.
Then you start to realize that the mitigation strategies are in there for a reason, and it's doable.
Governor Inslee also said the state's safety protocols, like mask wearing and social distancing, have to be followed in order for districts to bring kids in for in-person learning. And he also said that $3 million from the CARES Act will go toward helping schools develop safety plans. Christine Pitawanich, KGW News.
The state superintendent of Washington schools didn't hold back when talking about how things are going for students and teachers right now, using a word that would get many kids sent to the principal's office.
I've got a son failing 2 classes he's never failed in his life. He's taken AP classes all 3 years. He's struggling like hell right now because this is a system to teach a kid in right now. This instructional model does not work for a lot of kids, period.
That's Chris Rakedahl speaking to state lawmakers at a House Education Committee meeting last month. While he was critical of remote learning, you heard there, Rakedahl is not calling for a return to in-person learning statewide, but an acknowledgement that there's a trade-off with virtual school and kids are suffering. After months of partisan snags, a new COVID relief bill appears to finally be taking shape in Congress. Leaders from both parties and the Treasury Secretary met until late Tuesday night to hammer out a compromise deal. This morning, Senate Republican and Democratic leaders each spoke optimistically about passage, with Majority Leader Mitch McConnell pledging not to adjourn before a bill becomes law. The bill would total about $900 billion, which will include direct stimulus checks, likely in the $600 per person range.